Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
In testicular feminizing syndrome. In testicular feminizing syndrome, normal breasts are observed and female familial incidence is recognized in testicular feminizing syndrome. There will be amenorrhea here. Then, precocious puberty may be seen in all of the conditions except precocious puberty may be seen in granulosa cell tumor, head injury, and corticosteroid intake. It is not seen in hyperthyroidism. Then, precocious puberty associated with bony dysplasia and K-failure spots on the skin is McCune-Albright syndrome. That is McCune-Albright syndrome. Next. Which of the following is not sexually transmitted? Echinococcus, Candida molluscum contagiosum, and group B streptococci are STDs.
thank you and thank you for watching.